I'm sitting down with Dr. Lucica Ditiu, the Executive Director of the Stop TB Partnership. Today we're going to be talking about the Stop TB Partnership and what you're doing, what we can expect from you in 2016. So thank you very much for sitting down with me.
Thank you. Thank you for doing this, because I think we in TB need a lot of attention, and I think one of the tools to be used is exactly what you do. So as the Stop TB Partnership, and the biggest partnership that we have for TB, we are focused on doing advocacy and a lot of communication around the right priorities, but also we have some specific areas of work in providing drugs and commodities to countries, in providing support to different programs to be able to reach and put on treatment the most vulnerable and poor in the country, as well as working with Global Fund and with the communities to better engage them. But in looking forward to 2016 and actually linked with things that happened here, we will start with the rollout of the Global Plan 2016-2020. The Global Plan represents the first 5 years of the End TB strategy, which goes up to the 2035. So, when you discuss with leadership, global leadership in the countries, ministers of health and finance, they are not very much interested in what's going to happen by 2035. I am not interested in what's going to happen by 2035. So they want to see what they can do in a short time frame to build on their political capital and so on. So the Global Plan covers the first 5 years.
Now, the fact that we're hearing more and more stories from people who have been diagnosed with TB, does that tell you that the stigma is changing and the world is starting to see TB a little bit differently than we did before?
Yes. I have a bigger hope. We are not yet there, and it is a lot of stigma. And last night in one of the symposium that Stop TB Partnership has put together with our partners from Treatment Action Group, it was heartbreaking, because most of the people there said that actually the stigma of having TB is bigger than the stigma of having HIV. And in many countries from this region, people are more at ease to speak about HIV than TB. But I think we are changing that, and I think it helps a lot by having patients movements and people that had TB that are coming out and speak about their disease and how they were treated. We worked a lot, and we organized in November, and we continued here, first ever meeting of people affected by TB, and then a key affected populations meeting in which we actually brought not NGOs working with these people, but the real people. We got ex-prisoners, we got migrants, minors, people that learned on their skin what it means. The moment you put yourself in the shoes of someone that is suffering and can be stigmatized, the moment you think, how would I feel if I'm treated like this, that's the moment when the click will happen.
So it's really a more personal story that
Yes.
people should be hearing.
Yes, absolutely.
Now, you spoke about the next 5 years. Tell me about Stop TB Partnership's goals around the next 5 years.
Well, we are very ambitious, and I think for the last 3-4 years, we kind of delivered in growing forward. So basically, we are going with the Global Plan. So what we want is we will go towards a world without TBs. And it's like we make it or we break it. And so what we want to do is really achieve the targets of the Global Plan in having 90% of people that are having TB being diagnosed and treated, 90% successfully treated, and 90% of the vulnerable groups, however country will define them, being able to be diagnosed and treated. By 2020, we will not eliminate or end TB, but we will be on good track to do that.
Tell me about the most positive or successful takeaway that you're going to go home with from this conference.
I think I have hope coming from two places, actually. One is, as I said, a bigger participation of communities and civil society and patients. And that's due to the union, but it's also due to a lot of us that put our resources together to bring a bigger voice here. And in South Africa, it's really nice to have people like Minister Motsoaledi championing it. The second piece is here, linked to the Stop TB Partnership Board and the union meeting. There was the first ever Global TB Caucus meeting in which we had parliamentarians from all around the world coming. That was first time happening. In TB, we never reached at that level. So to have a mixture of kind of the people suffering, demanding better care and access, and the high-level politicians that are in charge of that coming together, I think that will be for me a big sign of hope.
Dr. Ditiu, thank you very much for joining us in South Africa. I hope you enjoy the rest of the conference and have a safe journey home.
Thank you so much for what you do. Thank you.